I think for me, it's just the notion that everybody actually is still very much in the same place, and in understanding that now is a very good time to be moving forward, and understanding that a lot of things are aligning, both from a point of view of where we are actually out in practice, advancing into professional care, understanding that health system transformation as a whole has probably been on the go for about 4 years now. So there's that groundswell for the need to be planning effectively. There's been a lot of innovation, and now there's the need to scale up. But I think what's insightful is people really still trying to get their head around the different levels that pertain to health workforce planning, whether we're talking about the industry and the things that need to happen at the macro level, the strategic, and how that actually flows down to those that are so they manifest themselves as ideas and as strategies for providers on the ground. And I think what was clear from the actual forum was that people still are getting to grips with that and getting to grips with a scaled up reality for health workforce planning. And so I think for us, it's important to, as a group, to sit down and break the tie, not just for providers on the ground, but also for patients, to be able to say, this is the type of direction that we're looking to go in. And from that, we can then start to build out the individual strategies that will help us deal with population-based issues, whether it's dementia, frail elderly, palliative care on the one hand, and actually dealing with the way we organize our services. I think immediately there was a lot of conversation in the forum about the need for there to be a formal table or for a conversation to continue. And clearly, what a great start this was as a one-off conversation with a number of different areas and aspects of health workforce planning. And it's clear that when you look at regional variation and the need for things to happen at that level, you still need to have that unifying conversation. There needs to be an ongoing forum, if you like, a place where we can develop a vision together and move forward. So I think that's a very important point. I think the other thing is we really need to double our efforts at the macro level in terms of being able to identify patient need as successfully as we can. And that means really breaking down, identifying our patients and looking at demographics, food security, social determinants of health, as well as looking at comorbidity so we can get a better sense. If we don't have that sense, it's going to be difficult for us to determine workforce design, determine the models of care that are going to be important for us moving forward. And it's going to be difficult for us to be able to grow a strategy that will endure, something that will be iterative, something that regardless of the situation of the system, regardless of what the issues of the day are with respect to health, we will be able to meet those with a systematic approach to health workforce planning.